filling in the rest of the buckle anatomy. I think I could probably skip over a little bit here. Yeah. Right, so he's filling in the buckle contours here, and all the way down to the proximals. I was popping it back in and double checking it, right? And he's actually changed his instrument now, so it's a bit of a carver that he has, a fine carver, and he's carving now the green wax away from the margin. So if there was any excess flow over the margin, he's carving it down, and this again is quite critical. This is to make sure, this is why we use a dye hardener, to make sure that the dye is not going to chip away, because we're using instruments and he's putting pressure on it. So the margins have to be really well-fitting margins, and we don't want to damage the margins during this procedure, which is so easy to do. Again, takes a lot of skill. If you notice how he's holding something quite small between his thumb and forefinger, he's a left-hander, so he's holding the carver in, supporting his fingers. So these are finger rests that the technicians learn, and this is the same finger rest you have to learn when you're holding your handpiece in the patient's mouth. Using the brush, cleaning it off, and really observing the marginal fit. Right? Just doing some fine shaping up now to the marginal ridges. All of this before you actually get into the occlusal anatomy. So if you get all this external contour correct, you're well on your way to getting the anatomy correct. So he's trying to show you that visual down, looking from mesially, looking down to the distal portions to make sure the buccal cusps are lining up properly and the palatal cusps are lining up in terms of their height and their position. Right, let's just jump ahead a little bit now. See if he's gotten on to the occlusal portion yet. He's still spending quite a long time getting the marginal trimming done. So when you're doing your temporary crowns, this is what you should pay attention to. What's my external contour looking like? I want to make it smooth. I don't want to have overhanging margins. And especially coming down to the gingival marginal area, anything that is bulky or thick or rough is going to trap plaque. So we want to get it smooth. We want to get it almost flat. Yeah, so that any plaque that may come there will be easily moved off either by floss or the patient's toothbrush. So your temporary crown is the same sort of attention to detail that I want you to spend when you've got a handpiece in your hand and you have a temporary crown that you're trimming up. Right, so he's gonna back a bit. So he's put it in now. Before he started, he's occluded the model together. Right? He's occluded the model together now, and that model has dilute opposing it. So he's checking now to see how much space do I really have before I continue my occlusal buildup, because you don't want to waste time trimming down a whole heap of wax. Right? So he's put the lower model together, and he sees now, right, this is where my contact points are, and it's still high, so he's going to trim that down first before he spends time on the internal occlusal anatomy. More you get right in the stage of the wax, which is pretty soft and easy to carve away, the easier it is. If it's not right and you end up casting it in gold, you will see from the latter stages how difficult it is to grind away gold and how much work you have to do at polishing it after. So it's best you spend that time and effort in this stage where you can get it absolutely close to perfect before you move along. So he's still adjusting the occlusion now, just on the marginal ridge areas, making sure the occlusion is right. And we don't want to introduce a crown to the patient where they've been biting before, and now suddenly you put a crown on there, and now they're feeling it high, or there's a big interference on the crown. Right? So it's critical we get the occlusion right. And if you notice, he's only using the model's handheld. So he's doing a handheld articulation. We haven't put this on an articulator. A single crown, if the patient's study models articulate very well together in your hands, and the ICP or intercuspal position is quite accurate and steady, then you virtually don't need an articulator for a single unit crown, right? For a 3-unit bridge, we would probably say no, we really need one because there's so much more occlusal area we have to get right. So we want to put it onto that semi-adjustable articulator to have some kind of degree of articulation that's close to the patient's natural articulation. Okay, so that's the purpose of it. But you can learn when you can get away with not having to use an articulator and when you really must. So he's filling in the mesiobuccal cusp here, and he's quickly filled in the distobuccal cusp here. Right, so these would be what we call triangular ridges. They look like sort of coming down from the tips, playing out within the occlusal anatomy. So these are the triangular ridges, the cusp, height, and contour that we have in a natural tooth. And he's filling in now the mesiopalatal, which is the largest cusp. He's doing this pretty quickly. He's heating the wax up really quickly. He's getting it to cool. He's blowing on it while he's working. And it's setting up, as I say, you wanted to set up in a nice convex pattern as it cools so that you can smoothen it, you can polish it. When you have lots of concavities, things are going to gather within them, right? And we don't want any sort of traps for plaque anywhere. So you need to know your anatomy for your fissure systems to even know what you're going to put in, right? He's doing the 6. If we were doing the premolar, it would be a lot easier in terms of the anatomy, a lot less cusps, right? And in the latter videos, when you come to see the post-infused metal crown on a 1-1, you'll see even a simple, so-called simple central incisor, what effort it takes to get the right shape and size and aesthetics with porcelain. So he's working on that and getting it to fill in pretty quickly. A lot of shaking up going on here. So that was a little longer that. But what you were looking at was him getting it to that full contour and contact points.